New year, new you, and new episode of Heal Woman, Heal the World. Welcome back. This is season 1 still, but episode 3 of our network production of She Is Still Dope. We are still here. It is a new year, and we are coming back on fire. We have lots and lots of great stuff that we have worked on after having a time of renewing and a time of reestablishing our goals. Our last episode, we talked about our goals as we went into the new year. And now that we're in the new year, we want to make sure that we are conquering those goals, keeping them in the forefront of our minds, and allowing ourselves to be the best person of ourselves that we can be. So welcome back. I'm so excited for this episode, which is entitled, Let's Take a Menopause. And I know many of us in this age frame, the age frame between 40 and 60, are dealing with some type of characteristics, some type of resemblance of menopause. And I wanted to get into that. So that's what we're going to do today. And I'm so excited because today we have an amazing guest that we're going to have on our episode today, in our show today of Heal Women, Heal the World. And it brings me such pleasure to have her as my first guest in the new year to kick off this season and these sessions for women. All of these sessions in the next couple of weeks will be surrounded around women's health. And it seemed very fitting to bring on our first guest. So I would like to introduce her. Her name is Miss Cherie Little, Dr. Cherie Little. She is a doctorally prepared, dual certified family and women's health nurse practitioner. And as a retired Air Force veteran, Cherie has experience in primary care, women's health, military medicine, labor and delivery, postpartum, medical, surgical, inpatient medicine, and aeromedical staging. Cherie loves to take care of patients and has a passion for quality healthcare. She is compassionate and utilizes a holistic approach to treat each patient individually. She has earned a 5-star reputation as a quality provider, and during her experience as a primary care provider, she met many patients seeking menopause treatment and specialist referrals for hormone concerns. Realizing a clear need for providers offering such services, Cherie became a credentialed Menopause Society certified provider. And in 2023, Xena Health was created to meet the needs of women in the Las Vegas area seeking menopause treatment. Cherie is dedicated to delivering evidence-based, top-tier menopause treatment and women's health services, fostering well-being and restoring happiness. Unique to Xena Health is Cherie's ability to provide holistic care from a primary care and women's health background with a menopause and hormone focus. She is passionate about helping women feel their best in life. Cherie is a board certified as a family nurse practitioner by the American Association of Nurse Practitioners and board certified as a women's health nurse practitioner by the National Certification Corporation. She is also board certified as a Menopause Society certified practitioner through the Menopause Society. She also maintains membership with the International Society for the Study of Women's Sexual Health and the Menopause Society, formerly known as the North American Menopause Society. We are honored to have her, Dr. Little, to join us. So without further ado, let's go ahead and bring on Dr. Little.
Hi, good morning, Robyn. Thank you for having me on.
Good morning. I have to drink some tea. Your bio was so amazing. My throat.
Oh my gosh, girl. It's different hearing it read to you. You know, you're like, oh, I may need to shorten that.
No, I mean, but then you don't want to shorten all of your accomplishments, Dr. Little, because I think sometimes we kind of have imposter syndrome where we're like, who is that? Like, I didn't do all that. That's not me. Who is she reading about? But
Exactly.
But no, you are phenomenal. Do not shorten it. I think it's great. It gives a great. The only thing I didn't see in there is I just want to congratulate you. I feel like the opening of your own health clinic was just one liner. I wanted to blow that up. Like, you opened up your own practice after you retired.
Thank you. Yeah. You know why? Because it's so scary. We've only been open for since August. So what is that? 4 or 5 months now. So you're still like, Oh, okay, yeah, we did this. Are we still doing it? Yeah, we're doing it. So
Well, I mean, I just want to take the audience back to when we were scared little puppies in nurse
yes,
practitioner school together. We
yes,
had the pleasure of meeting during our doings education for our doctoral studies. And
yes,
wow, 2014 through 17, which
exactly.
that seems like it
Right.
was just yesterday.
Yes.
And so we both went to school together at USIS, and that time was hard, right? Dr. Little, I don't know if it was hard for you because you were
Oh,
amazing and brilliant, but
oh,
it
no,
definitely
no, no. That was grueling. I would say one of the hardest times in mine and my family's life. Like, let's be
mhm.
honest, the whole
Yes,
family felt that one. Like it
yes,
was, yes, yes,
yeah,
you definitely have to be committed. But I will say the education that we were given is top A. I mean, it was so like just stellar. And
yeah.
so looking back, I'm so thankful because
Me
we
too.
were very well prepared. And
Agreed.
so yeah, it's hard when you're in it, but it's worth it when you're on the other
Right.
side.
And
Yeah.
now look at us, Dr. White and Dr. Little on a podcast, making our claim to fame here. And more importantly, we're helping women, right? And
Yes.
I think that is the hallmark of why I pursued to be a nurse practitioner.
Yes.
I didn't take the women's health route. I'm more family. I didn't get
Mhm.
certified in the women's health track, but that's what I take care of. That is definitely my bread and butter. Especially being an African American female, it really helps to have those patients that can see someone
Yes.
like them, relate to
Yes.
the symptoms
Yes.
such as menopause. So
Exactly. You're right. Because a lot of women seek female providers, and then a lot of African American women, they want an African American provider as well.
yes,
So yes,
yes,
so you are correct 100%. Yeah.
right.
You're right where you're supposed to be.
That's it. We are right where we're supposed to be. So all of the trials and tribulations were because it
Yeah.
was for a greater purpose, such
Yeah.
as what you're doing. Tell us a little bit about Xena Health and how you pivoted from retiring out of the military. And
Yep.
thank you for your
Yes.
service.
Well, thank you
And
for
now
yours.
into your own practice. Tell us a little bit about that.
Sure. So I did 26 years in the Air Force, went in straight out of high school. So I was a baby. All I knew was the military. And when I retired in 2022. So, and I really just, the military, I loved the Air Force, still do. Like, I love it. But after being in leadership for so long and kind of having so much responsibility and having to look after others, which I adored at the time, I really just wanted to focus on me. So
There's
the
nothing wrong with
first
that.
year after retirement, I just worked in an urgent care, and I said, I'm just going to clock in and clock out. And I don't want to really, be responsible for anything. I just kind of needed to decompress for a year and kind of rediscover my goals, if you will. And then after a year, I did Xena for two reasons. One is I realized, okay, yeah, I can do this, right? I think
Yeah.
the military, if you're in leadership, you have the skills. And when you get out and you start working for other people, you're going to be like, I can do this. So having someone else as my boss, I was kind of like, yeah, I don't know. And then the real reason, the passionate reason for me, because I decided, you know what, I think I can go do this on my own. So do I do primary care? Do I do women's health? What do I do? But I kept having women come to me, even in urgent care, and say, because we did primary care as well. And they would come to me and they would say, Cherie, I think my hormones are off. And we would draw their hormone levels. Hormone levels were normal. And I would say, well, everything I see looks good. And they would say, well, who can you send me to? And I'm like,
Mm,
I don't know, right? Because
mm,
and some of them would come to me and say, I went to my PCP or my OBGYN and I know something's wrong. Everybody's telling me it's fine, it's normal. And so then I started looking, okay, who do these women go to, right? And even in Las Vegas it's this huge, huge city. So you would think there's lots of specialists here. And so when I looked it up, which if you go to the Menopause Society's website, any woman can look up for a menopause certified provider in their city. So that's a good way to find someone local for
Oh, that's
you.
good to know. That's good
Yes,
to know. Okay.
yes. And so I went there, and there was only, well, right now I think there's only two of us, me and one other lady, but at the time I wasn't on there. There was only a couple people. And so I'm like, well, who do these women go to, right?
Right.
If nobody's really specialized in this, and it's not a hit on the healthcare society, because we could talk about that later. Like
Right.
we base that off of research and studies, and so hormones and menopause as a whole has really taken a hit. And so so I understood it, and so I said, well, you know what? I just decided I'm going to try this, right? So I'm a women's health nurse practitioner, family nurse practitioner. Why can't I be the one that learns menopause?
Why
And
can't
really
you be the answer to
right,
to the problem?
exactly.
Right.
Why can't I do that? And
Right.
so I did. So I started looking it up, and I started researching it. Went to the Menopause Society, studied, passed my certification. Woohoo!
Yes, congratulations. That's awesome.
But what I've learned is that's just the beginning, right? That's like the regulatory society saying this is all the data and the research. But now I'm listening to my patients. Now I'm learning from experience, and okay, what am I
Right.
actually seeing and learning and hearing these women tell me, right? You can
Right.
read about it in a textbook, and you can read what the studies say, but now I'm pulling it in from my patients. And so
Wow.
I think now the real learning is starting. And
That's awesome. That's
yeah.
awesome.
And so I am very passionate about it. I'm very excited. I really, I think all of us go into the medical profession to make a difference. And I
Yeah.
feel like this is it for me.
Yes.
Primary care, women's health, even urgent care. Sometimes you get in that grind of the day to day. And so this for me, this is where my heart is.
And you
So
found
yeah,
you found your niche. You found your
I found
niche,
my niche.
right?
Yeah. And I like it, and I really enjoy what I'm doing. Yeah.
And I think it's amazing because a lot of times God always opens up doors. He says that your gift will make room. That's one of the
Oh,
verses that I always think about. And sometimes we're like, what do I do? What do I do? But your gifts, your natural gifts, your born gifts, the things that you're passionate, that's where you should find your purpose, because
yes.
that's what will
Yes.
drive you to get up out of bed every morning, to be able to, touch someone else's life in a meaningful way. And,
Right.
and that is why I do Heal Women, Heal the World, because I am able to tell and give information that all of my friends right now are going through, right? We are like, what is going on in this world? Joints are hurting, you're moody, we're all irritable, nobody can lose weight. It's just,
Yep.
what is
Yep.
this?
Right.
And
Right.
I have been starting to dig in for myself, because now I'm experiencing the things women were coming to me with that I'm like, could have misdiagnosed, to be honest.
Right.
Because if you don't have the background or the education, you may just throw an anxiety medication, or you may just go down the line and do a whole bunch of x-rays because you really think there's something wrong with the joints. But
Exactly.
as you could tell us,
Right.
hormones are highly related to menopause and those types of symptoms. So, what is menopause? Let's take a menopause and talk about menopause. What is it? How
Woohoo.
do we define this?
So menopause is the transition from your reproductive years to basically when you no longer have oocytes or eggs to be fertilized, right? So it's a natural progression. I geek out on silly stuff. So if you don't want this, just tell me. But I think it's really cool that, and you remember that, I know Eustace taught us this, but
Yes.
it's really cool that when we are embryos in our mama's belly, we have all of our eggs that we will
That we're going to
release
have for the rest of our life.
throughout the rest of our life. Exactly. So we are given an actual number of eggs, and when they're gone, right? So you think every month through reproductive years, you have these eggs. So perimenopause is when you start to see that your body is coming to the end of those eggs being released, right? Your body is still trying to release an egg every month.
Right.
And then menopause is by definition 12 months after your last menstrual cycle. So it's a retrospective diagnosis, right? So I always tell women, as silly as it seems, you have to kind of keep track, especially when your cycles are spacing out, because you'll say, okay, well, I missed my cycle this month, or my last cycle was April. And then you have one, right? And then you go 2 or 3 months and you don't have one. So you're going to be like, oh man, when was my last cycle? I don't remember. I know I had one. So keep track of them, because the actual definition is 12 months of no menstrual cycle. You're now postmenopause. Yeah. So perimenopause is that whole transition when you start to have symptoms all the way through that final.
When does this usually start? What's the age that we should be thinking about this? Starting this process.
Yeah. So age 45 is generally kind of around when you're, generally when you're around that sweet spot. The average age of menopause is 51 to 52. When we were in school, it was 51. It's now kind of gone up to 52 because women are living longer. And of interest is, when you really think about it, the vast majority of women, since we're living longer, you will actually live more life in your postmenopause years than prior. Isn't that crazy? That's really cool. Crazy. Yeah. But it's crazy. And so I like to throw that out there to say, over half of your life will be in this phase. So you don't need to suffer and just live with it, right?
That's a very good eye opener. Yes, because I think we should talk about that, because I think we don't talk about it. And that's why I wanted to take this pause and talk about it. I mean, how many people out there have had their parents talk to them, or their mother particularly, talk to them about menopause? I mean, it's just not a conversation that you talk about. You may talk about, don't get pregnant, you get your period, you can get pregnant, don't get pregnant, or, go through the pregnancy years, talk about that. But we don't really talk about menopause. No. And so what would you say is a good conversation starter for those that may feel like they're experiencing it? And then Dr. Little, tell us, what are the things we should look for as far as symptoms? So how do we know the difference?
Those are great questions. So the number one thing is, I would ask the women in your family, if your mother, if you're still blessed and she's in your life. My mother's passed away, so I say it that way. Ask her, what age did she go through menopause? If you have your aunties, your grandmothers, what age did you go through menopause? Because that's going to be a big indicator for you. And then, what were your symptoms? I hear from my aunts that maybe they didn't have as many hot flashes, or they went through it fairly regular without any issues. But, it kind of gives you an indicator of what your experience will be similar to. You can't, genetics play an important role. And so you can't always get away from them. And so, so it kind of gives you insight. Now, the symptoms, you're right, they're so vague, right? So vague. They can be so many things. And I'll talk about those in a minute. But what I wanted to say, how you determine most likely is this perimenopause or menopause, right? So in the beginning, so say roughly, reproductive years, you're having normal cycles, right? Every month you're having them. Right around the age of 45-ish. For some women, it can be early. Some women go as early as 40 years old. That's premature menopause, but you can. So the age of 45 and right around that time frame, if you start to notice that your cycles are getting longer apart. So perimenopause is usually defined by the Menopause Society as changes in your menstrual cycle. So they classify it as, initially, if your cycles are greater than 7 days apart. So, we usually say cycles are every month, right? Well, maybe now you went a month and 1 or 2 weeks in between your cycles, right? So if you start to notice that they're lengthening between, maybe you're still getting them every month, but maybe it's not right on time, then you're probably in early perimenopause. Late perimenopause is when they're greater than 60 days apart. And then that's when it's going to start going, okay, now it's been 3 months. Now it's been 4 months. Oops, I had a cycle. We're restarting again. Okay. So that is the true definition, is when you see menstrual cycle changes. Now, you may start feeling things during that cycle or during that phase, but that's how we're going to determine it. Now, labs aren't really helpful in this phase.
And that's a good point, because a lot of women rush in and are like, draw my labs. My labs. They want some evidence of, like diabetes or whatever. They want evidence. but it's
Right.
not always a lab. It's more of the symptoms
It's
of.
your symptoms. And so I want you to pull me back because I have so much stuff I want to tell you.
Yeah, I got you. I
But
got you.
so then when you're actually in the menopause transition, so this whole thing, perimenopause to final menopause, can last like 6 to 10 years. Literally, it can take a
Wow.
while to get there. Okay, so when you're actually going through the menopause, like you're within that 12 months, that's when you're really getting your hot flashes. That's when you're feeling your worst, your night sweats, your hot flashes, your body's kind of going through it. You're having your ups and downs, you're irritable, your anxiety, all of that is kind of happening. You may be having joint pain, right? You may have vaginal dryness, pain with intercourse, a lot of those symptoms. And at that point, then we can start to see lab changes, but the labs are primarily FSH, so follicular stimulating hormone, which
Right.
the reason I told you about your eggs is because if you understand that's kind of cool. Again, I geek out. Your FSH is high because it's telling your body, hey, throw an egg out there, guys, we're ready. And there's no eggs to throw
No
out.
eggs to throw out.
So your
Okay.
FSH goes up. And so
It's
that's
working overtime.
yeah. And so that's one of the things that we can see on labs, but it's really, and this is the other reason I bring this up, is because this was even me, right? Like a year ago, before I did this, you would come to me, show me your labs. I'd look at the normal ranges. Okay, you're good. Like I've got nothing for you. I don't know what to do with you. But it's really not based on your labs. The only thing I can really tell you is your symptoms and then your FSH, right? All of your other labs very well may be normal. So we use your symptoms. And the Menopause Society, all menopause providers really nowadays go off of your symptoms
Right.
more than anything. Now, I still draw labs on all of my patients because I want to know your baseline. So that way, if I'm going to give you medicines, I then know what you started with. But I'm not always going to use them for clinical decision making, if that makes sense.
Yes.
Yeah. So
But that's good to know, because I think that's what happens, Dr. Little, is that we think we have to suffer through this, because if we do go to a doctor and they do just the traditional, let me check your labs, everything's going to be normal. So what would you tell women that may be experiencing these symptoms, and how to navigate through the transition? What would your advice be?
yeah, no, I'm glad you asked, because we need to be an advocate for all women. And so the first thing I usually say is you're going to have to find your person. And I know that's not an easy task, but I would start with your primary care provider. Tell them, hey, I think I'm having perimenopause, menopause symptoms. See what they say. A lot of providers won't necessarily check your hormones because, like I just said, a lot of them are normal. So they're like, there's no sense in checking them, right? If they do check them, they may say, okay, they're normal, kind of like I did, right? Like,
Yes.
I don't know what to do with you now. So go find someone that knows. But a lot of people do get very lucky and they find primary care providers that are advocating, and people like yourself, Robyn, who are like, let me figure this out and take care of these ladies. And so if you have someone in your corner and they're happy to do this, then yes, take advantage of that person, right?
Yeah.
But I'm
so
airing
one would be find your person.
find your person.
I like lists, you know me.
Yes, find your person.
Find your person. Okay.
Yep. And then determine, I usually, when I take a health history on a woman, I say, tell me everything that's happening. Because just like you do with your patients, I'm sure you're like, I already kind of have it in my brain what I think will work, but it's all about shared decision making. So when you find your person, what are your goals? Okay. If you have 10 things wrong that you're like, share, I can't do this, I can't do that, I can't do that. Okay. Give me your top 3. Let's tackle those first, right? Let's figure those out first. And then you develop a plan. And I want you to
find your person, develop a plan.
And what is your plan for you, right? So some people, the first thing that all people should be doing, diet, exercise, and sleep, right? If you're not sleeping well, you're going to feel horrible no matter what we're trying to do to help you. So you've got to prioritize sleep. You've got to prioritize healthy nutrition. So when I say diet, I don't mean weight loss. I mean healthy nutrition. And then exercise. you would be so surprised in just gentle walking, getting out, being active, what that does for your overall well-being. So those basic 3 things are your pillars, right? So you do that first, and then you can talk to your provider and say, okay, maybe you're more of a holistic person. You don't want to do hormones. You want to try supplements and other things. Okay, so we can go on that route. If you are interested in non-hormonal options, there are non-hormonal, that's not supplements, that we could do, or we could do hormonal. So kind of have it in your mind, where do I fall, right? I will tell you, hormones have the most effectiveness. And so those are going to give women the most relief from their symptoms, but there's nothing wrong with trying more natural remedies first.
Okay. So I find my person, I develop a plan. I think number 3, what I'm hearing is, I think you have to be open, right? I think sometimes we have our preconceived feelings, especially about hormones, but we have to be open to what treatment plan will work best for our body.
Exactly. Because there's so many different directions we can go with this. Right. And so it helps to have that foundation. Okay. Excuse me, Robyn, I want to tell you, I don't know if so one thing I wanted to touch on is the Women's Health Initiative. Do you remember that study?
Yes, I do. How it was kind of debunked, right? Because remember, we learned about it in school. And we kind of learned opposite of what they're putting out now. Do you want to tell us more about that?
Yeah. So I wanted to tell you about that, because when you talk about finding your person, so for the Women's Health Initiative, it was a huge study that came out. So for healthcare providers, it kind of rocked the medical world, if you will. Yes. So we had lots of women that were on hormone therapy and doing well. And then this study came out and it showed very poor outcomes, like increased risk of heart attack, strokes, breast cancer.
Yep.
And so it basically
breast cancer was really the one people got so scared about. I can't do hormones because I don't want to get breast cancer. Yes.
And so I like to talk about it because that's a huge, huge concern even today. And so here's the piece of it is, now there's a lot of stigma around hormones because of that study. A lot of patients are very scared to take hormones because of that. And then there's a lot of providers that, unless they've gotten out there and done the research, they don't really even know that that's been debunked.
Right.
And so, they actually, a lot of the investigators that did the study have come back out and actually spoken against their own studies.
Wow. What do you think went wrong there, Dr. Little? Is it just because that was a pretty large study? So it's hard to, you know what I mean? It's hard to kind of backpedal off of that because the data was seen, right? It seemed like it was so evidence-based. So
I'm reading this book right now. It's called Estrogen Matters, and I can give you more information about it, but it's in the menopause world, like most women, I follow a lot of other menopause providers on social media, and then also different studies and stuff. So different mentors kind of tell me different things to read and just to get educated on. So Estrogen Matters is one of them. And she talks about it in her book. And basically she says that the Women's Health Initiative, so the investigators that ran that study were not the people that wrote the reports. And so what happened is as they were finalizing all the study and it was coming to a close, they had third-party people that basically then wrote the reports. And when they finally did their meeting to say, hey, these are the findings, all the investigators were floored. They're like, what do you mean? That's not what the study showed. Yeah, right. Wow. This goes against everything in the medical community.
Right.
But because they had spent so much money on this study and it was such a huge study and there was so much time invested in it, they basically wanted to have results. And so they kind of overemphasized. And when they look back now, they're like, the results were the claims that they had were not statistically significant, but they wrote them to be statistically significant. And they made them seem far more important and far bigger. Yeah. And so there was some of the investigators actually then published reports afterwards discounting it and saying, no, that's not what happened. And there was this
So,
article.
so we,
I'm
I'm
sorry.
sorry, go ahead.
So
No, I
there
was
was this
just saying,
article that
so,
just came out last week. I was going to tell you about it because this
okay, go
is
ahead. Yes.
huge.
Yes,
And
just hot
so,
off the press.
yeah. So I don't know if I can show you, but it's this one here. It's called "'Tis But a Scratch," and it's a critical review from the Women's Health Initiative.
Okay.
Listen to what they say. So they say in here, because this is important because I get so many women that are scared of hormones. Okay.
Yes. So let's talk about that.
And so after decades of sounding the alarm about menopausal hormone therapy, the Women's Health Initiative now acknowledges that it is the most effective treatment for managing menopausal vasomotor symptoms.
Wow.
That's huge.
That is huge.
That
and
is
so
huge.
That's what we have to focus on, is because science changes, literature changes, but we should not, as women, have to suffer in silence. Ladies, correct, you do not have to go through vaginal dryness. We all like to have sex. Most of us do. Yes. And we want to have sex comfortably. You don't have to have uncomfortable intercourse because of vaginal dryness, which is a symptom of menopause. You don't have to walk around having hot flashes constantly through the day, taking your clothes off, putting your clothes back on. There is help for that. There is actually treatment for that. And even with your mood, a lot of people are not, don't want to take any medicines to help with their mood, which can improve their sleep, which you talked about, are very hallmark to making sure that you have sustainable life through the change. But if you can balance your anxiety, if you can balance your mood changes through hormones, then you can sleep better. So I think I just want to kind of take this menopause to talk about, there is help, there is treatment. You can find a certified hormone specialist like my friend here, Dr. Little, to help you get through those stages gracefully. Because we still want to enjoy life. You had me take a menopause when you just said that most of us are living longer. So why should we have to suffer through our golden years, right? Because during our 50s, 60s, we're supposed to be flying around the world, enjoying life, not laying in bed miserable because we're suffering from menopause. So I definitely wanted to kind of talk about, we have hormone treatment. We have holistic treatment. Our next episode that we're going to have following this one is the benefits of fasting. That's actually what saved me. There's lots of studies that are connected to intermittent fasting with menopause symptoms, because again, women are fighting 3 hormones through menopause and through the transition. So there's studies that show what types of foods you can eat during your kind of phases of menopause, and how fasting helps females kind of fight up against, because what is another symptom of menopause? Weight gain, especially around the midsection. And so and then a lot of us suffer because we can't lose any weight. We're just gaining weight. And so that is actually a symptom of menopause too, especially around the belly area. So I'm excited to hear that you are bringing that knowledge to the forefront of, please don't be scared of hormones. I mean, I think we need the disclaimer in there. There are women that can't do hormones. There's a group of women that would not be able to do hormones. Go ahead.
So, and I can talk about that. So if you have a history of breast cancer, then that's obviously one that you want to highly consider that. If you, and it's not that you can't do hormones. Usually we coordinate with your oncologist. So we would need to find out the specific type of breast cancer, even if it's estrogen receptor dominant type of breast cancer. You may still be able to do it. Now, I would always highlight that and say you should probably try non-hormonal first and see if you're going to get any benefit from that before jumping straight to hormones.
That makes sense.
Yeah, but history of blood clot, strokes, heart attack, cardiovascular disease are always concerning for those. A lot of not all, but some of the progesterone is actually the pills that they are supplied in. The capsules are made with peanut oil. So if you have allergies to peanuts, then you want to bring that up to your provider. And so I wanted to also tell you, because you were talking about embracing our inner goddess, living our best life, which is
Yes.
Zena Health's mantra. Um, Vasomotor symptoms, those can last for, upwards of 4 years, and then they usually go away.
Okay.
Okay.
Mm-hmm.
The whole menopause transition, as we said, can last for 10 years. The genitourinary symptoms of menopause, which is all the vaginal stuff,
Mm-hmm.
that can potentially continue to worsen throughout life. So
Right.
that will not necessarily go away. Your
Mm-hmm.
hot flashes, your night sweats, your irritability, all of that stuff will potentially go away, but the vaginal stuff will not. And
Yeah.
so, and it can potentially worsen. So I like to throw that out there because, again, I don't want women suffering. And so I
And
think if
and to
we,
give false hope, right? And
right,
other parts. I mean, we're just talking about. Well, we're gonna have to send them to you to get all the nitty gritty, details. We'll send them to your practice, Dr. Little. But another big thing is urinary tract infections,
yes,
increasing urinary tract infections because of the dryness.
yeah,
But a lot of people just think that that's normal, and they have to kind of, struggle
exactly.
struggle with that. And
Yeah,
so,
I'm glad you say that because we get frequent UTIs and we just think, oh, it's a UTI. No, it's probably a lack of estrogen. And so if
right.
we put you on estrogen, and it can actually be vaginal
Mhm.
estrogen can actually really improve frequent urinary tract infections. So
Right.
great.
So, ladies, I hope that this is shining the light on. You may be watching this and have never even linked the two to each other. You may just think that this is a normal part of your life, and it is. It is a normal function of our life to go through these stages, but it's not. It doesn't have to be normal to suffer through the phases. We want to grow gracefully. We want to grow and enjoy life to the fullest because, as we all know, life is short. So we don't know the time, the hour when we're going to take our last breath. So let's enjoy it while we have it. And we have, can you tell us where we can find you or how we can connect with you, Dr. Little?
Yes, yes. So I'm in Las Vegas, Nevada. My clinic is Zena Health. If you go to zenahealthlv.com, that's my website. My Instagram is Zena Health LV. And I also have Facebook at Zena Health, but you'll have to look me up on there. And I would love the more followers. I need them. I've only been open a few months, so please help get the word out. My IG, I'm putting reels and lots of information on there. So
All
even if
right.
you're not in Las Vegas, you can still follow me and get information.
So you heard that, everybody. So connect, like, and share for Dr. Little at Zena Health. You can see it in
Yay.
our tickler below. And don't forget to please subscribe to She Is Still Dope, our community. You'll get this. You'll be able to get more information specifically targeting you. So whatever questions you have, you are welcome to email us or even leave a little comment in the section. We read all those comments. We want to live our best life, and that is what Heal Women, Heal the World is about. It's about optimizing our health so that we can be the best version of ourselves, mind, body, and soul. And so, Dr. Little, I always like to kind of end and empower women because I think that we get all of the scientific knowledge, which is great.
Mm-hmm.
But we also have to heal our soul. So a
Yes.
lot of times there's you can't separate the mind, the body, and the soul. It's one package. And so I always want to kind of end with scripture references to help our followers to be able to put a scripture to it and be able to combat it through their spiritual mind. And so I was reading this great article, and it talks about God's promises and his interventions. And I'm sure you get this, but one of the complaints for many patients is tiredness.
Mm-hmm.
And actually, for me personally, that is my first perimenopause sign. Is, me, Cherie. I feel like I'm a ball of fire, but
Yes.
in this last year, I am so tired all the time. Just like I always feel like I have this heaviness, just kind of lingering. And I
Yeah.
was starting to read about how I can combat that. And tiredness is definitely kind of that hormonal fluctuation,
Mm-hmm.
especially around my cycle. I'm down for 2 days. Like, don't ask me to do nothing. I can't even function when my period comes. So one way that we can combat that is using this scripture of Romans 8:11, where it talks about, and if the spirit of him who raised Jesus from the dead is living inside of you, he who raised Christ from the dead will also give life to your mortal bodies because of his spirit who lives in you. And so I have to remind me that the spirit of God is inside of me, and he is the one that's going to give me the energy to make it through the day.
Yes.
Can't ignore the symptoms, but I know that I asked Jesus to come in and give me his spirit so that I can live and release some of the tiredness. So that is one. Is that a common symptom you see, tiredness, Dr.
Oh,
Little?
yes. Oh, yes.
Yes.
And for you, I know, I'm sorry. I just have to say how amazing you are, because we didn't talk about you in the beginning, but
it's not about me.
I know, but yes, you are a ball of fire, and you are just amazing. The stuff that you have done, and you are so inspirational, and I just adore you and look up to you. So no surprise that you're tired, but yes, you
would you say I have reasons to be tired?
You do, but yes, but if you're down for 2 days, then yes, you probably are.
Yes. I know it. I'm already from our chat today. I'm already saying, yep, I got that. I'm perimenopausal. So, the first sign is acceptance, right?
Right.
I accept it. Secondly, a lot of women experience joint pain. Is that a common symptom that you see? And I think because even with pregnancy, some women have their hips feel like they expand a little bit more, and that's hormonal as well, related, right? And so one of the scriptures to kind of combat the risk of osteoporosis is he protects all his bones. Did you know that there was actually a scripture in the Bible that talks about bones? I was like, oh my God, God covers everything. But in Psalms 34:20, he says he protects all his bones. Not one of them will be broken.
Wow.
I mean, we need to pray that prayer because that's and it just goes back to his promises of he will protect us even if we have to have these symptoms. We don't want to break anything. We want to live to our full life. We want our bones, exercise, weight training. I mean, we can talk so much more about that, but a lot of women are scared to lift weights, but we have to. We have to have that a part of our exercise regimen every single day or week. Like for me, I lift light. I don't lift heavy, but Tuesdays and Thursdays, I make sure I lift because that's what will keep our bones strong.
Yes. And can I interject? Do you know estrogen is now FDA approved to prevent osteoporosis?
See, I did not know that.
For bone health.
That is awesome. Yeah. So, and then hot flashes, we talked about that. And there's a scripture, Isaiah 46:4 talks about, even to your old age and gray hairs, I am he who will sustain you. And that's just kind of a promise, right? We're going to get gray hair. We're going to have sagging, skin, all of those things. But what's more important is that he's going to sustain us through this. We will able to go through menopause gracefully. And so I think that's important to talk about. He talks about poor sleep. There's a scripture in Proverbs 3:24 that says, when you lie down, you will not be afraid. When you lie down, your sleep will be sweet. I'm like, oh yes, who needs sweet sleep?
We all want that sweet sleep. Yes, we do. Right here.
And then lastly, which is something that unfortunately is wreaking havoc on our world today, and it's probably more of where I'll probably go when I do restructure my business, is this anxiety. And anxiety is just affecting us all across the world, from young to old. It is just, people are very anxious. And I think it's, yes, it is definitely one of those signs of menopause, but it's something that is affecting everybody across the lens. And so the last scripture, which I think is the most important one, is to cast all your anxieties on him because he cares for you. And that's 1 Peter 5:7. And that's a very touching, because if we try to just take everything, all the cares in the world, and try to fix them, we're going to be anxious. But if we can cast them on to him, he will take care of us. But we want to hold it. We want to fix it. We want to, we want to put a name to it. We want to, take ownership of it. But he say, cast your cares to him because he can take care
give it
of
to him.
you.
Yeah.
So those are just some foundational scriptures that we can give our women to help heal them. And I'm just so happy for you. I mean, I kind of fell upon knowing what you were doing by just scrolling through Facebook, and I was moved, I was motivated. I was like, oh my gosh, I need to contact her, I need to connect her. And you have done so much work from the first time that we decided for you to be on our show today, and I am grateful that you are my first guest at the first of the year. And I hope that through this, your business will be able to be blessed others a hundredfold, Dr. Little. And once you heal one woman, you can heal the world. And so I'm so excited that you are here. And I know we'll be connecting on many more platforms and podcasts. But is there anything you want to give our ladies before we end our show today?
The only thing I would say is don't suffer. You don't have to. Embrace your best life. Live your best life and take care of yourself and your body. Okay. I mean, we all want to live a healthy life, but we need role models. We need empowering women for our babies, for, the next generation. And there are very safe, effective methods out there that actually can help you. And a lot of times you don't know how bad you're feeling until you feel good. Right.
Yes.
And so just find your person, find someone that will take you seriously and listen to you and try to get you help. Look on the Menopause Society's website. Go to Robyn. She's fantastic.
Thank you. Yes. Yes. Right back at you. So again, if you want more information, you can find Dr. Little at Zena Health LV. You can also follow us on She Is Still Dope, Heal Women, Heal the World. I air my episode every last Saturday of the month. So look forward to our next episode where we talk about the benefits of intermittent fasting. And we have a whole series over the next 4 months that specifically target women's health. So thank you for joining us today. Men, I haven't forgot about you. It's just all about us right now. So I'm worried about healing women, healing the world. But we also know we need our men to do that. So thank you for taking this menopause with us. And thank you, Dr. Little, for joining us on the She Is Still Dope Network. And we appreciate your time. Have a great day, everyone.
Thank you for having me. Yeah.